Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today's guest is Dr. Helen Thomas. Dr. Thomas is a family physician who has been at NorthPoint for the last 4 years. She loves taking care of patients from ages 0 to 100 and has special interests in prenatal care, addiction medicine, LGBTQIA+ care, and health at every size. She went to undergrad at Macalester College, then medical school at Michigan State University, followed by residency at the University of Minnesota. And we are glad to have Dr. Thomas here to talk about HIV/AIDS awareness. This is a topic that Dr. Thomas has some expertise and special interest in. So thank you for joining us and answering our questions.
Yes, thank you so much, Biftu.
All right, so let's dive right in. Tell us what is HIV and what is AIDS?
So HIV stands for human immunodeficiency virus, and this is a virus that attacks the immune system of the body, which makes us more susceptible to certain types of infections and also types of cancer. A lot of people don't realize that the immune system also protects us from cancer within our own body. AIDS, which is acquired immunodeficiency syndrome, that's what that stands for. That's when your white blood cell count gets so low from the HIV infection that you become at risk for even more diseases, and we'll kind of talk a little bit more about that a little bit later.
Absolutely. Tell us, what are symptoms of HIV?
So an important thing to know is that a lot of people don't have symptoms early in the infection, and you can actually remain without symptoms for years, which is why it's so important that every adult who's at risk of HIV gets tested regularly. But early symptoms can include, fatigue. There are certain rashes, other skin changes that you should look out for.
All right. And then you sort of started to answer this when you were defining what AIDS is, but tell us about chronologically when a person does have AIDS.
So that is when your CD4, which is a certain type of white blood cell, when your CD4 count gets below 200, that's when you technically have AIDS. But there are also certain conditions that you develop in HIV and AIDS that are called AIDS-defining conditions, like pneumocystis jirovecti pneumonia. We also call that PCP pneumonia, Kaposi's sarcoma, which is kind of like a skin lesion that looks kind of like a rash. And then encephalopathy, which is when you become very confused and your brain is actually being affected by HIV. So those are some of the things. If you have that, you have an AIDS-defining condition.
Okay. And tell us about where in the body HIV, the virus, is found.
So it is found in the blood. It's also in semen, vaginal fluid, anal mucus, and then is also found in breast milk.
Okay. And how can HIV be transmitted?
So there are several ways that it can be transmitted. The use of a contaminated needle, sexual acts of several kinds that I'll talk about, and then it can also be transmitted from a pregnant mother to the fetus, and then also rarely through breastfeeding. That's pretty rare, but that can happen.
And let's talk about prevention. So what does that look like for HIV?
Yeah, so obviously we're super excited about preventing HIV at NorthPoint, and we've really learned a lot about HIV transmission. The first step is testing everyone. The first step is knowing who has it. So literally every adult should get an HIV test. That's just like a across the board recommendation. And then if you're at higher risk of developing HIV, then you should be tested more often. So people who are at higher risk are folks that are having sex with multiple or new partners, whether that's oral, vaginal, or anal sex. Any of those ways can be a transmission of HIV. If you're injecting anything into your body without a brand new clean needle, you should be regularly testing yourself for HIV. You're getting tested for HIV. And then, to prevent the transmission, using a condom or a dental dam when you're doing sexual acts is super important. Unless you and your partner are sure that neither of you have HIV and neither of you are at risk of developing HIV, then you should always be using a condom or a dental dam. So speaking of if you're injecting into your body drugs or medicines or anything and you're not using a clean needle, there is a needle exchange that we run at NorthPoint. It's called In and Out. It's at Broadway and Lyndale next to the Merwin Liquors in the Sanctuary Church there on Broadway. They are open from Tuesday, Wednesday, 2 to 5, and Thursday to Friday, 11 to 5. They are also doing HIV and Hep C testing there, and you can get clean needles there for whatever reason that you need needles. So that's a really good way to prevent transmission, is always use clean needles. And then there's a fairly new therapy that I'm really excited to talk about that a lot of us are prescribing at NorthPoint. It's called PrEP, which stands for pre-exposure prophylaxis. Okay.
Yep.
So this is a medication. It's a pill, just one pill that you take every day. If you're at high risk of developing HIV, like if you have a lot of new or frequent sexual partners, if you're injecting things, just like the things we just talked about, you can, anyone at NorthPoint or most of the providers at NorthPoint can prescribe this pill to you.
Sure.
Take it every day, and you're much less likely to develop HIV, even if you have sex with someone who has HIV, or even if you inject a dirty needle, you're much less likely to get it. So highly recommend to ask your provider about that.
Great. Thank you. Thanks for sharing. Let's talk about new developments in trying to cure HIV. What is out there?
Yeah. So there was right now, HIV is not curable, unfortunately. There was a big news story a couple years ago where a man in Europe, I can't remember all of the details, but he developed a blood cancer and got chemo to kill the blood cancer, and then got a bone marrow transplant. Bone marrow is actually where our white blood cells are made. So he got the bone marrow from a donor and put it into his bones and essentially replaced his entire immune system, which got rid of the HIV virus. But, so he was cured of HIV technically, but that's a very dangerous procedure. He could have died in the process of that treatment. And so we wouldn't do that to anyone just to cure their HIV. But what we do have is really great antiretrovirals, and these medications can drive your HIV virus load in your blood down to undetectable, which we say in medicine, undetectable means untransmittable. So, if you're taking your medication from your doctor for your HIV and you're undetectable, then you cannot transmit HIV to anyone else. So it's not a cure. You have to keep taking the medications, but it is an awesome thing to help prevent further infections.
Absolutely. Thank you. And I do recall seeing lots of headlines about a quote unquote cure, but I appreciate the clarification.
We're working on it though. Their research continues to happen.
Yeah, definitely. And I think you kind of already answered this about treatment. So is there anything else you want to talk about as far as treatment options?
So there are a lot of effective treatments, and many people with HIV can now live a normal, full, healthy life, and that's awesome because, something I wanted to point out is I think a lot of people of my generation, folks born in the 80s and the 90s, don't remember kind of what we went through as a society and the world with AIDS in the 80s, HIV and AIDS in the 80s. So I actually have a couple TV shows that I want to recommend that might give people kind of like a background on it.
Definitely.
So Pose is a really great show on Netflix that is about the Vogue and ballroom scene in New York in the 80s. But it also touches a lot on kind of what the community went through with HIV at that time. And then It's a Sin is another show on HBO Max, which is about England. And they talk about, what that community went through, the gay and trans and, genderqueer community went through there in terms of HIV. Because it's important to remember, this was really, this was a terrible, terrible thing that was not being recognized. Because it was affecting a lot of people that were marginalized. And it's important for us to remember that.
Absolutely. Thank you for the recommendations.
Totally.
That does, get out there.
Cool.
So you said how it's important that every adult gets an HIV test. So tell us about what that test looks like.
Yes, so we do need some sample of blood for an HIV test. There are rapid tests that we can do a finger poke. And if that test is positive, then we do need to confirm it with a blood draw, like a venous blood draw. But yeah, we are happy to do that at the Needle Exchange near Merwin's, at any of the NorthPoint sites on 800 West Broadway or Heritage Park, or at our main site. Or, at any time, just make an appointment and get HIV tested. We're always happy to order that for you.
Great, thank you. Let's talk about certain populations where HIV is more prevalent.
Yes, so that is another thing that I really want to talk about.
Yeah.
Black people of all genders are at higher risk of HIV. And that's something that is important to talk about. And it's also it's especially high in Black men who have sex with men, and also men who have sex with men of any race. People who have been incarcerated are at higher risk of HIV. Transgender women are really high risk, especially Black transgender women. And also Latino folks and injection drug users are some of the higher risk folks. Why this is so is pretty complicated. There's a lot of, socio-political issues that go into it. HIV rates are higher in certain communities, thus raising the risk of new infections with each sexual or injection use encounter with people who tend to hang out with their similar races and genders and things. But also factors such as stigma. I mean, structural racism, makes it so that Black people and other marginalized communities have less access to treatment, education, prevention. And so that's something that, keeping an anti-racist lens as we're talking about this type of thing is super important to recognize.
Absolutely. Is there anything else you want to say as far as social determinants of health and other maybe related factors to being HIV positive?
Yeah. So, because of structural racism, Black people, especially, and other marginalized people are less likely to have housing, which can, contribute to, living in risky situations. Less likely to have resources to access going to the doctor and getting treatment and education. And so, it's important that, really we need to start with focusing on uplifting Black communities and doing anti-racist work in order to prevent diseases like this. It's kind of like starting at the beginning of the stream as opposed to like the Mississippi Delta. You know what I mean? Like we need to continue to look upstream at the causes of these diseases. Yeah.
Awesome. Thank you.
Yeah.
I guess we talked about services at NorthPoint, but what is available? You can let us know again.
Yeah, totally. So, we are the healthcare home for all of North Minneapolis residents. And, that's the same for, especially for HIV positive people. So we have care coordinators who, if folks are having trouble coordinating their visits, making it to appointments, remembering to pick up their medications, difficulty understanding their conditions, we have something called a healthcare home care coordinator who will call you and explain things and communicate messages to your doctor if you have questions that arise in between visits. So I think that's kind of one of the biggest things that's helped increase access to folks who have difficulties, accessing healthcare. We have our clinical pharmacists who, for HIV patients will, make sure that the medication is covered by insurance, make sure you can pick it up and you can afford it. And they also help with medical management. They can sit down with the patient. They actually get an hour, if we do a consultation with them, they get an hour to sit down with the patient, go through each medication, talk about why they're taking it, what the possible side effects are. Are there alternatives? And so, that's another one of the great services that is especially helpful for our patients at risk of HIV or people who have HIV. And then, we wouldn't typically start HIV treatment at NorthPoint. So if you are diagnosed with HIV, we would refer you to infectious disease. And we would, we usually refer to Hennepin, but we could send you kind of anywhere in the cities to get that specialty care. And then once you have an established plan, then we can manage your primary care as we usually would. And included in that primary care is, of course, dental care. It's so great that we have dental on site, especially for people who don't have insurance, because it's extremely hard to access a dentist if you don't have insurance. Even if you do have insurance, it's hard to access a dentist. So it's really great that we have those services at NorthPoint. And then our behavioral health, because there are a lot of mental health problems that come along with all sorts of life problems, as we discussed. And so having access to therapists at NorthPoint is a really important service that we have. And then, of course, sorry, I'm kind of going on, but because there are so many resources at NorthPoint, that's amazing. Then, our human services is just doing an awesome job of kind of doing the wraparound, talking about helping people access housing, helping people who have been previously incarcerated, helping with workforce, helping you find a job. So all those services are available for any person that comes to NorthPoint, but we're especially obviously interested in being this medical home for North Minneapolis.
Yeah, definitely. Thank you. So we have a little bit of time, and I just want to throw out one question that I sort of thought about as we were talking. So if you're someone listening to this interview and you think to yourself, well, I might be at risk, what do you recommend as a doctor? What would you recommend for someone who thinks that they might be at risk?
Totally. So, I think the best thing to do would be to call, 612-543-2500 and make an appointment with a doctor. Yeah, there's a number. Nice. Yeah, so make an appointment with a doctor, a nurse practitioner, or PA at NorthPoint to talk about your risk, get tested, and then make a plan going forward for how to prevent getting infection. Maybe, you might need PrEP, maybe taking that, I forgot to mention the brand names are on TV all the time. So Truvada and Descovy, we can prescribe those to you if you feel like I'm at high risk. I can't change my risk right now. And so, I'd like to get that. Just call and talk to one of the doctors, even if not every doctor prescribes it, but even if they don't, they can connect you with me or another doctor there that does. I think in general, it's just important for everybody to have a primary care provider. So if you don't know who your doctor is or who your provider is, call and get one, because you should have someone that when you're listening to this interview, you're like, oh, is this me? You should have someone that you can ask that question of. And we really want to be those people for you.
Yeah. Great.
Yeah.
Thank you. Awesome. Well, that's all my questions. So thank you for, being so informative and helping shed light on a topic that not a lot of people know much about, but we're trying to raise awareness. So thank you. We appreciate it.
Yeah, absolutely. Yes. Thank you so much for having me on.
Thank you.
Hi, my name is Gabe. I am part of the To The Point program here at NorthPoint Health and Wellness. To The Point encompasses everything from family planning to our early intervention HIV services. Family planning, we'll meet with clients and patients in their rooms when they're here for their appointments. We give out free condoms and education on STIs and HIV prevention. So if anyone has any questions, they're always free to ask, or they can give us a call at 612-543-6737. We also give education on safer sex practices with birth control, and usually educate people on the different types of birth control methods and different types of HIV prevention interventions. Over at our Harm Reduction and Testing Center located at 710 West Broadway, we provide participants and patients with a lot of different methods for HIV prevention, including education on how HIV is transmitted. We give out sterile injection equipment. That is a main course or a main prevention strategy is to give out sterile works and injection equipment. When we give out safe injection equipment, we also give people education on the transmission of HIV and Hep C, how that happens and how to prevent those types of things. We also give education on safer sex practices while people are using drugs. And then we also give out free condoms. We also offer HIV and hepatitis C testing during our service hours, which are Tuesday and Wednesday, 2 to 5, Thursday and Friday, 11 to 5. We'll do HIV testing in an early intervention type of way. So we'll do the test, and then if it were to come back reactive, we also make care linkages to places like Positive Care Downtown or other places, or PEP if a client is interested and has risk factors, and then give education on U equals U and PrEP and PEP as well. And then try and link them with care to other providers for anything else that they might need concerning HIV status or disease status.
Thank you, Gabe. That was Gabe from NorthPoint Health and Wellness Center's Harm Reduction and Testing Services, located at 710 West Broadway in Minneapolis, 55411. For more information about harm reduction and testing services at NorthPoint, please call 612-223-3682. For HIV testing appointments, please call 612-627-0305. Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors,